the medial side of the arm, and down this way. That's the brachial artery.
Oh.
Okay. That's where you usually take a baby's pulse, is on the brachial artery.
Okay,
looking at me
next.
like that.
We're
Jeez.
rolling. Come on.
Proceed.
So we have some special tests. Do you guys have any questions about the bony landmarks?
No.
Okay. So special
Did you
test.
wait? Sorry. Did you show us the bicipital aponeurosis?
That's where it comes down and attaches here to your forearm, to your ulna.
Okay.
That's where the biceps brachii and the brachialis tendons combine into one tendon attach. Okay.
Excuse me.
So, the first one is the test for ligamentous stability. We did this with the knee for the medial and lateral collateral ligaments. We're doing the same thing. The person can sit or stand. You're going to cup the posterior aspect of the patient's elbow in one hand and hold the patient's arm with the other. Your hand on the elbow will act as a fulcrum around which the other hand will force the forearm during the test. First, you're going to instruct the patient to flex his or her elbow a few degrees as you force his or her forearm laterally, producing a valgus stress on the joint's medial side, and then reverse the direction and push the fulcrum medially, producing a varus stress. Okay? A negative sign is going to be no gaps or are palpated, okay, by the hand that's holding the elbow. And then a positive sign is that you will have a gap. You will have a palpable gap palpated on either the medial or lateral side, depending on which ligament is torn, okay? So, this is what it'll look like if I do it on Jean. Her arm is going to be slightly flexed. I'm going to cup the elbow, and I'm going to use the fulcrum, and I'm going to provide a valgus stretch, right? Because if I'm doing this, I'm creating an L, valgus. So I'm creating a medial or valgus stretch on the elbow, and I'm seeing if there's a gap between the bone and the epicondyle here, okay? Then I'm going to take it and I'm going to put a varus stretch, right? A lateral stress on the lateral collateral ligament, and I'm trying to see if there's a gap in between this condyle and the head of the radius. Okay, that's what I'm feeling for. So this is what's, are you my person?
Yeah.
So this is what it's going to look like. Okay, I'm going to have her arm here. I'm just going to test to see how your ligaments are doing on the sides of your elbow, okay? So I'm going to flex her elbow a little bit. I'm going to first push this way, causing a valgus or medial stress on her elbow, and I'm feeling if there's any gaps. I don't feel any gaps, so that's a negative test. Then I'm going to push from the inside of the elbow, creating a varus stress on the lateral side, and I'm feeling if there's any gaps here, okay, with my thumb. Does that make sense?
Mm-hmm.